Sure. I'll be brief. Yeah, I mean, discussions today just sort of taking that term all the way back to years ago when we first met. A lot of talk about artificial intelligence. I think that the conversations today. It seems that there's sort of I think we're all sort of groping around to try to find the proper bridge between healthcare outcomes, blended financing, and technology has come up several times over this conversation today, and AI specifically mentioned. I'd like to propose just a brain exercise to sort of, when you think about AI, you can look at AI to me is the computational process to create data assets. But I think what you're more interested in is the value of data that you can extract from AI. And I think it's especially interesting to think about how that integrates with blended finance, public-private partnerships, because data assets themselves, they can become part of a financial model. We're actually involved in a couple projects dealing with food security, one dealing with healthcare assets specifically, where if you can use the proper infrastructure to preserve the value and privacy of data. It's been said that longitudinal health records can be valued with the genetic profile at about $6,000 per person. If you can harness that value of data, I think it gives an interesting tool so that blended financing and other sort of special purpose vehicle. I'm not a finance person by any means, but I think there's a real opportunity to look beyond AI methods, how that you can instead build data value and incorporate that into financial models.